Hey everybody, this is Dr. Ianella from the North Owl Wellness Center in Miller Place. Wanted to speak to you today about anxiety and emotionally related problems. I have a very extensive past history dealing with my own emotional issues as a kid. When I was diagnosed as a manic depressive, I was put on multiple medications that basically took about 2 years from my life, four different drugs. 100 pounds later, feelings of depression and suicide that plagued me as a kid from 17 to 19 with no results. And finally, out of pure anger, with my frustration of getting no results with the doctors I work with, I threw the drugs away literally one day. And I began to investigate why it is that we have emotional disturbance. My particular emotional disturbance was diagnosed as bipolar disorder, or manic depression, as many doctors call it. And I got no answers from medicine as to why this happened, no help from medicine. As I began to heal myself naturally at the age of 19, what I did is I changed my diet. I got off of sugars, I lost quite a bit of weight, and I started going to the gym just to work out my body. And what ended up helping me get through my own problems was basically changing my diet and adding good nutrition into my own system. It was that experience that led me into the field of natural health care and has led me on this path for the last 35 years now of trying to figure out why the body does what it does and how we can help it get better. So when it comes to understanding emotional disturbance, I have a very good personal extensive history and 35 years of experience in this particular arena. Many of my patients come in very commonly, not people that are mentally ill, but people that are just anxious, stressed, feeling overwhelmed, unable to shut off, just completely wound up by life's events. Life is going faster as time goes on. We're getting input from more and more places than ever before, from our phones, from our computers, from our televisions, from pretty much social media, from everywhere we go. Everything is just being blasted at us time and time again. And what is occurring is that we're all really basically in overload. Whether it's sensory overload or life overload, it just builds and builds and builds to the point that we now want to just explode because we have so much going on and we can't even control our own energies because we're just literally overwhelmed by the huge amount of things that are being blasted at us. Now, ironically, when we work with our patients who have quote-unquote anxiety, depression, emotional ups and downs, one of the most common things that shows up that I want to encourage you to find out whether or not you need or not is mineral deficiency. If I tell you how many of our patients are mineral deficient that have emotionally charged disturbance, it's got to be upwards to 80 to 90%. So one of the most common solutions that we find for our patients that have any kind of emotional problem is some kind of a mineral. What mineral? Well, it could be anywhere from a calcium deficiency to a magnesium deficiency. It could be really quite a host of very different minerals because there's over 60 different minerals that are supposed to be within our bodies from a day-to-day basis. So we have an examination procedure that allows me to actually check the body for a specific mineral deficiency, and then through examination we could find what mineral will work best for that particular patient. So as we see strength returning to the body as we're examining it, we know that that mineral is what's going to work for that patient. And it is quite usual for a patient within 2 to 3 to 4 weeks to feel remarkably different and actually feel more comfortable in their own skin than they had in years after taking years of medications and the drugs that are out there, which really do nothing to correct the underlying cause of the anxiety. Whereas here at North Owl Wellness Center, we're really trying to function more on the reasons why one would have emotional problems such as anxiety. So please, take that under consideration, give it some thought. Go to our YouTube channel, subscribe to it, leave me questions or things you want to hear about, and from there I'll come back to you and give you some more information. Until then, this is Dr. Ianella talking at you. I'll see you soon. Take care.